Most golfers are asking the wrong questions before they ever choose a treatment for their knee pain. I know exactly what you're dealing with. Let me see if this sounds familiar. You've got a knee that's starting to mess with your golf game. And somewhere along the line, one of your playing buddies told you that the answer to all of your problems and all of your woes is obviously a PRP injection, or it was stem cell injections. But listen, that might not be the real decision to make at all. My name is Dr. Gayan Poovendran. I am a medical doctor who specializes in sports and regenerative medicine, and for the last 15 years, I have helped thousands of golfers eliminate their knee pain without resorting to invasive surgeries. What I want to show you today is really simple. A lot of golfers end up choosing the wrong treatment, not because they're careless. They end up choosing the wrong treatment for their knee because there's been nobody there to really help them figure out what the knee actually needs. A golfer like you may hear PRP and stem cells, and they may think that they're choosing between two products that are on the shelf, one that is good and one that is better and one that is best. Look, that is the completely wrong frame of mind. Your knee, like my knee, is not a menu, but when there is knee pain involved, it does have a problem to solve. One guy may have early wear and tear, but a lot of good joint space left to work with. And then the other guy may have more damage and more swelling and a knee that's starting to behave like it's already written its resignation letter. Those are not the same patient, and they should not get the same treatment or the same conversation. Now, before we go any deeper, if this is the kind of straight talk that you want, please help me out and subscribe to this channel. I make videos like this every single week for golfers who want real answers, not just some clinical brochure nonsense. And since I actually want you to use this stuff and get better, I've also put together a free 5-minute warm-up guide for golfers that's designed for golfers with knee pain. It is called the Ready for Tee Off Guide, and you can grab it right now at readyforteeoff.com. It is absolutely free. There are no strings attached. It's my way of thanking you for watching these videos. So go grab it, get it, come back, and I promise I'll be right here. All right. Welcome back. Once you know what the knee actually needs, the PRP versus stem cell question becomes a lot clearer. Now, for most golfers with mild to moderate arthritis, the answer is usually one of three things. It is PRP, it is a fat-based treatment like Microfat, or it's a bone marrow-based treatment like something called BMAC. These treatments, though, have to be matched for what we actually see inside your knee. So PRP is, again, a blood-based treatment. We take a small amount of your blood, we concentrate the platelets and the healing factors, and we inject those healing signals back into the joint and where the injury is. With Microfat or MFAT, it's a fat-based stem cell treatment. So we take a small amount of fat from your midsection, both sides, so that way your fat is even, and then we gently process it so that we keep the tiny little clusters and cell matrix in mix and in what we call their niche, and we put that back into the knee and again back into the damaged areas. BMAC is bone marrow based, so we take a small amount of bone marrow from one of your hip bones, which I promise you doesn't hurt nearly as much as people think it does. We concentrate those stem cells and the growth factors down, and then we inject those into the joints and into the areas that had problems. All three of those things that I just mentioned are real tools. All three of them can help knee arthritis, and all three of them can actually disappoint you if we match them to the wrong knee. That is the part that matters more than any of the individual names or treatments. But here, there's one more thing that makes this conversation a whole bunch more messy. When people out in the community use the word stem cells, they're not usually talking about just one thing. Sometimes they are talking about Microfat or BMAC, which is the two things that I just described, but sometimes they mean the stuff that is newer to the market that seems to have a lot of marketing dollars and sexiness behind it, and people market them as stem cells. Those are things called Wharton's jelly or umbilical cord stem cells or exosomes, or the newest hot topic is Muse cells. Look, I'm not saying all of that stuff is nonsense. Some of it may prove itself over time, and I'm very excited and open for that. But right now, with a lot of those bottled products, I believe the marketing is moving much faster than the actual medicine. Now, that's different from Microfat and BMAC, where there is real biology and there is real data behind what we're doing. So if you're asking me what I'd actually choose for a real knee in the real world, or actually what I've done in my own knee for myself, I'm not asking what is the newest, coolest, shiniest thing. I am asking which of these 3 tools actually fits the knee the best. And sometimes it's more than one, but here's how I actually think through this whole process. If you have decent joint space and you can still walk 18 holes even though it hurts at the end of the round, and your imaging shows mild to moderate wear, that's often a knee that responds really well to a blood-based approach like a PRP. If you have more wear and tear, or you've already tried a well-done PRP treatment and it helped but not enough, now I'm looking at your knee and I'm thinking that it needs more biological support and maybe a different tissue type and different tissue environment. That's when something like a fat-based option like Microfat or MFAT can actually make a lot more sense. Now, if the joint is under heavier stress and the damage is more advanced or more complex, or the bone underneath the joint is starting to get involved and become part of the reason you're pain, or the clear goal is just to buy real time before we're having a bigger conversation, that's when something like bone marrow based treatment like BMAC might be a better fit for you. What I want to be very clear about here though is that none of these is an upgrade over the other. None of them is a downgrade compared to the others. They're all just different tools for different problems. Now, this is also where people get themselves into trouble with the word stem cell. They hear it and they assume that bigger must mean better, that more expensive must mean more advanced, and that newer must be superior to the old stuff. That's not how this works. The right tool depends on the right knee and the right person attached to it, not which name on a bottle sounds the most impressive. Let me give you a real example. I had a golfer come in recently who came into me convinced that he needed the biggest, baddest, most advanced stem cell treatment therapy available that could be found. He said money was no object, he didn't care how much it cost. And he had already been to another doctor who had told him he was bone on bone by someone who hadn't really looked at his full clinical picture. Tried to sell him a very expensive stem cell procedure, and what he actually had was early to moderate arthritis with a lot of pain from something that wasn't really the arthritis and a lot of fear attached to that. Now look, that's a different kind of problem. He didn't need the most aggressive thing on the list. He needed the tool that actually matched his knee, and in that case, that ended up being a more simple procedure than I think even he expected. For someone else with more advanced damage, the right starting point may not be PRP, but it might be Microfat or bone marrow from day one. That happens a lot too in my practice. The point here is that one treatment doesn't always win. The point here is that the right answer changes from person to person and actually from knee to knee. And to be honest, there's a lot of times where I'll use more than one of these in one person just because each one of them brings something different to the table. And then let's address the other thing that I hear a lot, which you're probably in this stage right now too, where you say, well, I might as well just wait, right? It can't be that bad enough yet. Well, look, if you wait until the knee is truly, truly bad, when I mean bone on bone, constant pain, constant swelling, now you're starting to lose function in your knee, you're losing range of motion. What ends up happening is your options start to get more narrow. No matter which one of those 3 tools that you which one of those 3 tools you eventually choose to go with. You don't want to show up to the game after you've already lost 5 holes. The mild to moderate stage is where you have the most leverage. That's when things like PRP or Microfat or bone marrow, whichever one actually fits your problem, has the most to work with. And that's when you still have a real shot at delaying or avoiding replacement. I understand. Let me tell you a story about a patient of mine many, many years ago. He was a 27 or 28-year-old kid that had pretty bad knee arthritis much earlier than we would expect. He first came to see me and I told him, you know what, after x-rays, he had plenty of joint space. He was somebody that PRP would be plenty for. So we talked about it. He wanted to go home and think about it. A year and a half, 2 years later, he shows up at my office saying his knee still hurts. And I said, well, what's happened in the last 1.5 to 2 years? He said, oh, you know, I've been managing with cortisone injections. Well, now he's interested in PRP. So 2 years have passed. I want to do a whole evaluation on him. So we take new x-rays, and his knee arthritis went from having this much space to this much space. He became truly bone on bone. He had alignment problems, and now he wasn't a candidate for the simple procedure. He needed something much more advanced with a lot more bells and whistles associated with it. It took a lot more work. I get it. Waiting feels safer, but just like in that story, in knee arthritis, waiting usually means your window gets smaller. And what that does, it narrows your options no matter which treatment you're leaning towards. So if you take nothing else from this video, take this. Other than don't wait. Don't let a label make the decision for you. Don't assume that stem cell is automatically better than PRP, and that's what you need. Don't assume that PRP is always the safe, simple starting point either, because the label of what we're doing doesn't treat your knee. It's the match that does it. So here's the one thing I want you to do differently. Stop asking PRP or stem cells and start asking, what is my knee actually telling me and which one of these tools actually fits it? What that means though is getting a real evaluation that looks at how bad the arthritis really is and what other associated soft tissue problems are associated with it, whether this is mild or moderate or advanced arthritis. And also we have to have a real conversation about what your goals are and which of the three, whether that's PRP or Microfat or BMAC, which one of those actually matches the picture of who you are and where your knee is. If you do that, a lot changes for the positive. You stop chasing ads, you stop paying for the wrong thing, and you stop treating knee pain like it's a shopping problem. And then you start acting like someone who actually wants to keep playing golf for the next 15 or 20 years, because let's be honest, nobody wants their knee treatment chosen the same way they pick sunglasses on Instagram. The real win here for you is not that I got the fanciest injection and my knee feels better, and it's also not the I got this simplest injection either, right? The real win here is that you get the treatment that you need that actually matches the knee that you have, and you make that call early enough to stay in the game, okay? Let me give you one thing that you can do before your next round. This is from my Ready for Tee-Off guide. It's called the reverse lunge with overhead reach. What you're gonna do here is you're gonna step one foot back into a reverse lunge, and as you lower into that lunge, you are gonna reach both arms overhead. You're gonna come back down, you're gonna drop your arms again, and then you're gonna switch sides. Here is the cue that I give my patients. The overhead reach here is a non-negotiable. What this is going to do for you is it's going to open up the hip flexor on your back leg, and that is something that gets tight from sitting at a desk all week. Tight hip flexors quietly dump extra load onto your knee and make it hurt. Why does this help? Because it helps wake up the hips, it helps open up the front of your body, and it helps take stress off the knee before you even tee off. Now for that complete 5-minute routine, don't forget to go and grab the free Ready for Tee-Off guide at readyforteeoff.com. It does have the illustrated instructions for all 6 of the exercises that I recommend in the order that I recommend you do them. You can pull this up on the PDF on your phone right before any single round. Now, if you found this video to be helpful and it helped you think differently about PRP and stem cell treatments, send this to the guy in your group who keeps asking doctors the same questions but never gets a straight answer. And before you go, again, don't forget to grab that free Ready for Tee-Off warm-up guide at readyforteeoff.com. It is 5 minutes before your round. That's it. Then you might not need any of this other stuff anyway. I'm Dr. Gayan Poovendran. Now you know what most golfers never find out. Keep following here, and I'll see you pain-free on that fairway.